Cervical cancer. Cervical cancer occurs in the cervix, the lower part of the uterus that connects to the vagina. It primarily affects women and has slowly developed over time. Early stage symptoms including vagina bleeding after sex, vagina bleeding after menopause, vagina bleeding between periods or periods that are heavier or longer than normal, vagina discharge that is watery and has a strong odor or that contains blood. Pelvic pain or pain during sex can also be an early stage symptom. Early stage symptoms including vagina bleeding after sex, vagina bleeding after menopause. For advanced stage, symptoms include difficult or painful bowel movement or bleeding from the rectum when having a bowel movement. Difficult or painful urination or blood in the urine. Dull backache. Swelling of the legs. Pain in abdomen and feeling tired. Risk factors: HPV infection, especially high-risk types like HPV-16 and HPV-18 is the main factor that cause 70% of the cervical cancer cases. Most HPV infections go away as the body immune system fights off the virus. However, long-term infection can damage the cervical cells, which eventually leads to cervical cancer. Sexual history. Beginning sexual activity at a young age can also increase the chance of getting HPV. Smoking and long-term use of oral contraceptive can also be factors that contribute to the risk of cervical cancer. There are 3 types of diagnosis. The first is colposcopy, which is examining the cervix area by using a colposcope. And the second way is biopsy, which is removing a tissue sample from the cervix examined under a microscope. There are 4 types of biopsy to check for cervix cancer that are punch biopsy, endocervical curettage, loop electrosurgical excision procedure, and cone biopsy. Pap test, collection cells from the cervix to check for abnormal changes. Just like most of the other cancers, there are 4 stages for cervical cancer. Stage 1, this stage can be divided into 1A and 1B based on the size of the tumors. The cancer cells have grown through the surface of the cervix into deeper tissue of the cervix. The cancer area is about 1/8 inch deep, which is 1A, to 4 out of 5 inch deep, which is 1B. They have not spread to nearby lymph nodes or distant organs. Stage 2. The stage can be divided into substage 2A and 2B based on the size and location of the tumors. The cancer has grown through the cervix and uterus, stage 2A, or spread to the parametria, 2B. They have not spread to nearby lymph nodes or distant organ. For stage 3, the stage can be divided into 3A, 3B, and 3C based on the size and the location of the tumors. The cancer has spread to the lower part of the vagina, which is stage 3A, to the wall of the pelvis and block the ureters, stage 3B, or to nearby pelvic lymph nodes or para-aortic lymph nodes, which is stage 3C. They have not spread to distant organs. For stage 4, there are sub-stages 4A and 4B based on the location of the tumors. The cancer has spread to the bladder and rectum, are stage 4A, and to distant organs like lungs and bones is stage 4B. There are 3 types of treatment that are surgery, chemotherapy, and radiation therapy. There are 3 types of treatment that are surgery, chemotherapy, and radiation therapy. There are 3 types of treatment that are surgery, chemotherapy, and radiation.